This is what happens if you ignore a slip disc.
Spinal stenosis is a progression of slip disc. So spinal stenosis occurs when you have slip discs and the joints have overreacted because now they have to take on more burden. So over time, they also get thicker. What happens is that your nerve is now trapped. And that condition is known as spinal stenosis. Patients are not able to walk longer than a few kilometers without experiencing severe pain. They walk for a few hundred meters and they get severe cramping pain that travels down both their legs, and it is so severe that they have to stop, sit, rest for a few minutes before resuming the activity, before resuming walking. So those symptoms are typical of spinal stenosis. So chronic slip disc can occur not just at one disc but at multiple discs. So you may have slip disc at one segment. That means that this segment is now weak. The disc can no longer function normally. Hence, the disc below and the disc above, they have to do more work. They have to take on more burden. Leave it long enough, this disc will also suffer from slip disc because they now have to take on most of the burden that was previously distributed evenly among the discs. So you have slip disc, you have joint dysfunction, you leave it long enough without attending to it, you leave it long enough without doing anything to make it better, for example, physiotherapy or getting treatment for it, then you have a condition where the entire spine structure gets tight. It starts to impinge on your nerve root. So you have a condition similar to this. This is what a normal disc looks like. The yellow portion is the disc. The white portion is strong ligaments that hold the disc in. And this yellow structure at the back here is your spinal cord. The joints that I was referring to are these joints at the back here. So these joints allow movement. So it allows you to bend forward, bend backward, bend sideways. So this is what normal looks like. When you have slip disc, what it means is that the disc, the yellow portion, has now broken through the ligament and is now impinging against your spinal cord or your nerve roots, right? Now the fact is that this ligament prevents the disc from coming back. So slip disc cannot be reversed on its own. So physiotherapy, exercises, yoga, Pilates will not make this disc come back. Once it's out, it's out. And the natural progression of this is that it will continue getting worse from time to time.